As the threat posed by COVID-19 started to take shape in the early months of 2020, so too did the clear need for a vaccine. The person overseeing those efforts on a day-to-day basis is now detailing them. Warp Speed, inside the operation that beat COVID, the critics, and the odds, details the Trump administration's attempts to bring a COVID vaccine to market. The federal effort supporting multiple COVID-19 vaccine candidates resulted in 2 vaccines greenlit for emergency use in under a year. That's a record timeline, a timeline many thought impossible. Paul Mango is the author of that book. He's also the former Deputy Chief of Staff for Policy for the U.S. Department of Health and Human Services, and he joins me now. Hi, Paul. Thanks so much for being here. So we're over 2 years into this coronavirus pandemic. Now that you've had some time to reflect back on everything, is there anything that you look back on and say, I wish we did that differently?
Oh, goodness. If we had an hour, Caitlin, I think I could go through a whole bunch of things that we would do differently. But let me start. I think the world has recognized that this is the most successful biomedical public-private partnership in history. And the Commonwealth Fund just keeps track of the number of American deaths prevented by the vaccines coming to market so quickly, and it's over 2 million. So we feel very good about that. But if we could go back 2 years, there's a lot of things we do differently, and I think it would start with communications to the American people, which I don't think we did a very good job of, and in particular, communicating with their physicians early on to talk about the safety and effectiveness of these vaccines.
And to come up with a vaccine at that pace, it was unprecedented, an extraordinary feat. But the speed of its development still remains one of the biggest reasons that a number of Trump supporters refuse to take it. So when you were at HHS, how did you try to address that thinking? And was there anything more the former president could have or should have done to address that? I mean, he didn't talk about getting the vaccine until months and months later.
Yeah, Caitlin, somewhat ironically, the head of the Center for Biological Evaluation and Research at the FDA, that's the center that approves the vaccines, Peter Marks, he's the one who came up with the name Operation Warp Speed, and was supposed to denote a sense of urgency, on behalf of the American people. And I think appropriately, some of the American people viewed that as, wow, you're going way too fast. But coming back to the communications issues that I mentioned a moment ago, there's 2 things we should have communicated very differently. One is that the requirement for the phase 3 clinical trials of having 30,000 participants for these vaccines was significantly higher than any previous vaccine. The normal average is about 20,000. Second, most persons have an adverse reaction, if they're going to have one, within 42 days of getting a vaccine. We extended the evaluation period to 60 days. So again, somewhat unfortunately, these vaccines went through rigorous standards that were much higher than any prior vaccine in American history, yet we didn't do a great job of communicating that. Now, why didn't we? You asked. Very simple. If we had actively tried to communicate before the emergency use authorization was granted in December of 2020, if we tried to communicate to the American people that these are going to be safe and effective vaccines, we would have been accused of trying to manipulate the FDA. And in fact, in some cases, we were accused of manipulating the FDA. So we had to be very careful and walk a fine line between what we would say publicly versus what we knew was happening privately, which was these were developing as very safe and effective vaccines.
I want to ask you about something in Science Magazine. I mean, this is a publication that's not known for political bias. And in this magazine, they said the CDC, quote, had botched the rollout of its initial COVID-19 tests in early February. And the Trump administration had attacked or muzzled agency leaders for speaking basic truths and repeatedly forced the CDC to soften its scientific advice. Now, a House investigation also confirmed that the Trump administration tried to suppress COVID testing. What do you see as the Trump administration's impact on the CDC?
Yeah, it's very interesting. In fact, they did botch the testing rollout in February of 2020. That's well known. What happened after that was we learned that the CDC, while populated with tremendously talented career officials, was fundamentally unprepared to deal with a fast-moving global pandemic. They were unprepared from an information technology standpoint, where they were getting obsolete data, incomplete and inaccurate data. They didn't have the operational posture to go and deal with surges, and they had a cultural issue, which was a function of them being in Atlanta and the rest of us being in Washington, D.C., and during an urgent situation, we needed everyone in the same foxhole, and that wasn't the case. So I think there's a lot of reflection that has to take place around what is the role of the CDC going forward, and hopefully that's being undertaken now before we face a similar pandemic.
Certainly. And can you talk to us about the final months of the Trump presidency? I mean, I remember right after the election when we saw the news of the Pfizer vaccine, it seemed like an opportunity for the then president to really kind of champion the vaccine, but he was, pretty much focused on the election still and false claims about fraud. But what were some of the challenges that you and others leading this Operation Warp Speed, what were some of the challenges that you were facing at that time?
Yeah, it was a very exciting time for us, as you can imagine. And we subscribe to a principle known as subsidiarity. And what I mean by that is we trusted the public health jurisdictions, and there's 64 of them, to tell us who they wanted vaccinated first, how many doses they wanted to deliver to what location at what time. And what happened in the early days of the rollout of the vaccines, which was, as you said, December 14th for Pfizer, December 21st for Moderna, they were using these vaccines, but they had trouble reporting back to us that they had used the vaccine. So it looked like we had shipped out, 20 million doses of vaccine and only 6 million were being used. So everyone was starting to question what's going on. How come no one wants the vaccines? Indeed, what we learned was it was a reporting issue. They were 5, 6, 7 days behind in reporting who had been vaccinated. And when you're only 2 weeks into it, that's basically half of the time. So we came out on January 12th, Secretary Azar and Bob Redfield, the head of the CDC at the time, and said, listen, from now on, we're going to publicly report what percentage of the vaccines we've shipped to you that you've actually used. And boy, did the governors and mayors shape up after that. And we started getting the reports in less than 24 hours. And then you saw all the numbers going up. So that was a challenge to us because operationally, everything was going extremely well. But the reporting from the public jurisdictions was lagging, and that created somewhat of a media frenzy, if you remember.
And we just have a minute left, but even in endorsing your book, the former president referred to COVID-19 as the, quote, China virus. Subsequently, a number of Republicans have fixated on the virus's origin. The Biden administration has greenlit an investigation, which was inconclusive. But is the potential origin more important than treating the problem?
Well, I think they both are, and it depends on what stage we're in. I think when we were in the middle of it, obviously dealing with the issue was the most important thing. But we need to understand, Caitlin, where this came from and how it developed to prevent the next one. And I did speak with Bob Redfield a couple weeks ago. He's convinced this was an engineered virus out of Wuhan, China. That's important to understand, not to punish China, but to prevent the next one from happening. And I think that's where we should turn our attention at this juncture.
All right, Paul Mango, thank you so much for being here. We are very lucky and grateful to have vaccines to keep us safe. Thank you for your time. Appreciate it.
Hey, thanks, Caitlin, for having me.